else that's coming in.
Okay. Welcome everybody. Just so everybody's clear, this is the internship webinar, so thank you for joining today. We're going to do a bit of an overview about what, if you could just move to the next slide, Hannah, please. So the purpose of one back, yeah, there we go. So the purpose of today really is just to give you an overview about what the internship is. And we have a few of our interns from this year who are going to just share a bit about their experiences over the past year, which will be really helpful to give you a flavour of what the internship is, what you can do, what the benefits are, and then we'll quickly run through the actual application process. So Rebecca will just take us through the application that if you're planning on applying that you'll be working through. And then obviously any questions that you may have, we'll try and answer them via the chat primarily. If you can pop those into the chat so that we can all see them, we'll keep an eye on those and make sure that we get the answers to those questions for you. But equally, if you want to raise your hands, feel free to do that as well. So we'll try and keep an eye out between us for your questions and answers. So we've put aside about an hour and a half. We may not need it. We may need it. So please feel free to answer any questions as we move throughout the presentations. So Michelle, I think if we just do a quick round of introductions, I know that's the beginning bit of your slide, but if we just do a quick round of introductions around the capacity building team. So I'll start. My name is Kirsten Winfer. I'm a research fellow with the ARC, specifically the mental health theme. And I joined the capacity building program and also work on capacity building events and seminars. So that's me. Shall we go around in terms of the capacity building team, Michelle?
Hello, good afternoon. My name is Michelle Briggs. I'm a clinical professor of nursing with the University of Manchester and Manchester NHS Foundation Trust, and I am the academic theme lead, the capacity building theme lead for ARC GM.
Thank you, Michelle. Rebecca?
Hi everyone, I'm Rebecca Mcshane. I'm the Programme Manager for the Applied Research Collaboration, working specifically in the capacity building team.
And Hema?
Hi everyone, my name's Hema Ali and I'm the Project Support Administrator for Capacity Building.
Thank you. And we have a number of our, as I said, our interns, but also internship supervisors as well. So as you move throughout the day, or throughout the webinar, if there's any questions, then supervisors and interns, if you want to chip in, please feel free to do so. Shall we get started with what the internship is, Michelle, and just do an overview of for everybody what is the ARC internship? That would be really helpful as a start.
Yes, thank you. Next slide, Hema. As you can see here, there's we are a training and capacity building team, and we've done some introductions, but that just gives you a sense of people who are involved in supporting the internship programme within the ARC. Next slide, Hema. And our role in the ARC is our aim is to increase Greater Manchester's capacity and capability to do excellent research, but also use the results of the research and generally research to improve the health and social care of the population. And building research capacity is a key theme within the ARC because building research capacity for healthcare professionals is widely recognised as an important mechanism for enhancing health services delivery. And we do that across these three populations here: academics, health and social care frontline staff, and public and community involvement. Next slide, Emma. We're also absolutely committed to promoting equality, diversity and inclusion in all of our capacity building activity, and we do this by exploring methods to increase diversity within our internship programs, all of our programs, promoting equality and diversity, training for all of our staff involved in the recruitment process, and being as flexible as possible for all of our programs. So we're really keen to hear your experiences and listen and respond to individual needs so that we can be as inclusive a research group as possible. Next slide, Hannah. And we have there are many opportunities to build research capacity, and the internships are at the beginning of that. We have 10 internships a year. We have pre-doctoral fellowships. That round of pre-doctoral fellowships this year is just completing. We have PhD fellowships, and we also offer mentorship to postdoctoral researchers. Next slide, please, Hannah. And internships, the focus of today's webinar, occur at the beginning of, this is the NIHR Careers Research Pathway, and I think it's worth saying that internships are the entry into potentially a clinical academic career that has a pre-doctoral phase, a doctoral phase, and early and more senior postdoctoral phase leading to a chair. And currently I'm a clinical chair. So that's just to locate where internships sit. Thanks, Emma. The next slide, please. And internships, their role in capacity building is threefold. You get the opportunity to experience all three as an intern. And indeed, as the intern supervisors, they gain experience and skills in enabling all three. That's foundational skills. So that's using research, understanding how to search for, appraise, and apply research evidence, participate in research, so that's assisting with participant recruitment, data collection, or maybe using databases and secondary data analysis, and also thinking about leading your own research. So it's time and space to develop your own research protocols and apply for research funding. Next slide, please. So what do we know from the valuations, or what's the evidence base for internships? Why do we do this? Well, there have been 2 or 3, as you can see here, studies, qualitative and quantitative, to look at the impact of doing an internship. Next slide, please, Hannah. And generally, there are key themes that come out of those internships. The drivers for applying, what's the motivation for doing an internship, the personal impact on interns and their careers, and the impact on the practice where the internship is located. And also there's a key theme about mentorship and networking, but there are also challenges. So I'm going to very quickly give you an overview of all of those themes. Next slide, please, Hannah. So the drivers for applying, these are some direct quotes, both from interns. IT4 is an intern. Internship was a great option. I got to experience what real life research was like. But we're going to hear from some of our interns on this webinar. But also I'd like to point you to line manager comments, which this is one line manager who said it was great to see these internships give people a real chance to understand what an early career research looks like, what it is, and how it differs from service development or clinical audits. It gives you protected time to assess whether or not it's a long-term career for them. Next slide, please. But not only that, the impact on interns' career and personal impact. When this is a quote, I learned what a research career looked like working with patient partners and a wide clinical research team to improve patient care. So not just sitting in an office evaluating what's already been done. And as you can see here in blue, these were the things that the interns in these evaluations said that they'd gained. Next slide, please. And also, not only had they gained a personal impact, but the impact on practice. People were better able to evaluate research and incorporate it into their practice. So you may feel that as an intern, you may not move along the clinical academic pathway that I presented earlier. Having said that, the internship in itself has helped people be better able to evaluate evidence and improve the services that they're delivering. And also line managers recognised, say here for this quote, for me as a service manager, I needed to ensure that this was something that would improve patient care ultimately. And another line manager was saying that he or she hadn't appreciated the positive impact it was going to have on the wider department. And that certainly is something now has rippled through the rest of the department. So internships aren't just for the individual, they're also a benefit to the team and the department. Next slide, please. But that's not without its challenges. There are challenges, and these were some of the challenges that interns and mentors identified. That you shouldn't underestimate the real pull of the day job here. That you need to still deliver clinical services, and it is really difficult to practically put that in place, which is why we offer peer-to-peer support network, mentoring, and the supervisors have a lot of experience in helping people navigate how to carve the time to be able to get the best out of your internship. Next slide, please. And this is a slide taken from a mixed methods project, which was a sequential qualitative and quantitative data collection phases that looked at a range of people, both the interns, their managers, their academic mentors, and other stakeholders. And the points that we're using this to make sure that we're enabling, I want to point to the barriers to success, which are around the influence of the managers and being connected in. So we're really keen to work across with all of our partners to make sure that the internship is understood and being able to be used effectively, but also the enablers of success. We're absolutely thrilled. We've got supervisors here who will be able to answer questions, and ARC GM has a strong supervisory team to support the interns to be able to have that internship that is intern driven. But also today I'm thrilled to be able to introduce some of our interns to show that the impact of the internships this year has had on them and their service. Next slide, please. And success rates. That's the quote if anybody wants to read the mixed methods exploration. And I apologize if you can't quite see those tables, but what they're indicating is that if you do choose to go ahead for future funding for pre-doctoral fellowships or postdoctoral fellowships, roughly about, certainly within NIHR, within this study, 50% of those people who applied were successful, which is an extremely good successful rate. So it does seem to indicate, and certainly for other professional bodies and charitable funding, the success rate is a little higher here. So I think there is evidence to suggest that an internship is a strong platform to increase your ability to be successful in pre-doc and doctoral applications. Next slide, please. So the next round coming soon, July 2021, it's here, it's launched. Rebecca's going to talk you through the application process. Our internship offering is 30 days, which can be taken flexibly over, and that's 225 hours. So it doesn't have to be in days, it could be in half days, whatever works for you. Can be taken flexibly over 12 months. There are different types of internships, structured and more unstructured, but they're all designed to give you a taster in research and first-hand supervised experience of applied health research. There are opportunities, and I emphasize opportunities to do postgraduate further study. It's not an obligation, but there are lots of opportunities, and there's a personal training budget attached to allow you to undertake master's modules should that be something that you see as a gap in your experience. This year, as I say, we've moved our internships to be over 12 months. We recognise for those people working part-time or those who have carer responsibilities, a short period of time might prevent them from applying. So we've extended that time. We've also worked with our partners to develop some ideas and topics that align much more closely with what I've been talking about in the presentation in terms of making sure that our internships do have an impact on the care for our service users and patients. And I'm going to leave it there because Rebecca will be talking you through our application process. But thank you very much for listening, and I'll hand you back over to Kirsten.
Thanks, Michelle. Does anyone have any questions or comments? And that's from current interns and supervisors as well as new folks joining us today to learn about the internship. Is there anything that anybody would like to ask at this stage, either through the chat or raising hands? And if not, we'll move through. If you could just move on to the next slide, Hannah, please. Once again. There we go. We wanted to do a section, and our interns have very kindly spent time today and in the preparation of these slides to share with you why you would want to do an internship and what the benefit is for you. And we've had a variety of different types of internships and people who have applied this year. So it'll give you a really good overview of what the internship could mean and the opportunities that it might pose for you. So we have a series of overviews of our current interns. If we just move on to that next slide, Hema. Our first intern who is just going to share an overview of her experience is Lizzie Walkden. And I'll let Lizzie introduce herself and take it from there. If you'd like to start us off, Lizzie.
Okay. Hi, I'm Lizzie Walkden. I am a speech and language therapist at Wythenshawe Hospital. So I work with them in MFT and I'm an acute and critical care lead here at Wythenshawe Hospital. So next slide, please. So I thought I'd give a bit of a background of my clinical experience. So I'm currently a band 7, as I said, working on critical care and acute wards. But in the past, I've worked across neuro rehab and stroke, and I've worked in lots of different parts of the country. So Gloucestershire, London, and then I moved back to Manchester about 3 years ago because this is where I'm from. So I am part of the speech and language therapy team, but also part of the wider critical care team here at Wythenshawe. We've got quite a big critical care service. There's 3 critical cares, an acute one, a cardiothoracic and a burns unit. And within the cardiothoracic team, there's also transplants, so heart and lung transplants there. And that's where my kind of special interest is. I really like working with those patients. So in terms of my research experience to date, because I have started working in transplant for the past 3 years and I really enjoy it, lots of questions have started coming up in my head about, you know, wanting to answer some things about eating and drinking disorders with these patients. I'd previously been involved in writing some publications, but never really been the lead on those publications. I'd kind of been involved in some recruitment for national trials, and as part of my day-to-day work, I do a lot of kind of audits and creating posters. I've presented at conferences with those posters as well. So I'd started to kind of dip my toe in research, but hadn't done a huge amount of leading it. So next slide, please. So what did I want to get out of it? There's a really kind of strong ethos here in AHP world, but also in the speech therapy department for research. So I wanted to get a bit more of exposure into kind of the academic world, which it's been really useful for. I also wanted to develop my research skills. As I said, I'd kind of been doing some practical things, but I felt like I didn't have as much of the theory to underpin it. And I really wanted to kind of get back involved in study. I hadn't studied for a while, so I wanted to see, you know, if I could do that and also if I could incorporate that into my clinical kind of role. So in terms of what I actually ended up doing during the internship, I was really lucky. I've had a really supportive supervisor, Jill, who's on the call, I'm sure. And we spent a lot of time kind of talking about the ideas that I had and developing kind of some questions that I could do something practical with during the 9 months. Obviously, it's been really difficult to fit it in because of COVID and just, you know, working on critical care has been incredibly busy. But we eventually agreed, kind of in line with some of the work that I was doing on the masters, which was around kind of systematic reviews, and with kind of Jill's skill set, we decided to develop a systematic review protocol. So a protocol for what you would do if you were going to complete a systematic review around a question. And then, so yeah, I wrote that up, which took some time. It gave me a chance to kind of look at the literature that was out there and create a bit of a literature review, which was really helpful. I've then started, I've not completely finished yet, but doing a rapid evidence review. So doing like a mini systematic review of those papers. And I have put together a bit of a presentation for my team, which I'm going to be doing in a couple of weeks, just to feed back on a lot of the literature that I found. I'll then be creating a poster which to kind of summarize everything that I've been doing. And on top of that, I've done the master's module and completed that, and it's been graded and everything, which is excellent. So, oh, and on top of all of that as well, I think, you know, I've met loads of people during the time of the internship. So people have put me in touch with other people to talk about research skills and to talk through my questions about what kind of research I could do, which has been really, really helpful. You know, like people that are specialists in doing cohort studies or searching the literature, and also just having the exposure to those free resources that are out there as well, like webinars and events that you can attend in evenings and stuff to just improve your research skills, really. Next slide. So finally, what next? I think it's given me the confidence to do more research, if I'm honest. It's kind of shown me what is possible within a clinical kind of setting as well. So and it's also kind of you know, given me the confidence in what I was already doing. I think sometimes we belittle the things that we do in clinical kind of spaces, and actually we're always collecting outcomes, and there's lots of little audits that you can do that make a difference, and it's given me the confidence to kind of encourage our team to carry on doing that. I think me personally, it's kind of shown me that I can study, I can learn still. So I would like to carry on and complete more of my masters. I feel like it's kind of shown me that there is still loads to learn about research, and I want to keep doing that. I have put in a pre-doctoral fellowship application, so I'm moving up that chain, hopefully, of research skills. And I think it's given me the support, the confidence as well to carry on supporting others. So as Michelle was saying, you know, it's given me the confidence to kind of in evaluating evidence a little bit better. So we have things like journal clubs and stuff like that. So I've brought some of those skills to those. And also, you know, incorporating, when you're thinking about audits, it's made it much easier for me to think about the research and, you know, what makes good research from the outset, rather than trying to apply some of those skills later on. And it's also given me an awareness, and our team, because I've been forwarding things on to them the whole time, you know, of what's out there, what resources there are, what other teams you can link in with to get support. So yeah, that's everything from me. Thank you, Lizzie. I think that was a really good example of one of the points that Michelle brought out, about it's not, you know, there's a big benefit to you personally and professionally, but also to the wider team. And it's that cascading of information and that real, I suppose, the crux of the capacity building, you know, that we're trying to achieve personally, professionally, as well as for the wider team. So thank you very much for sharing your experience. Great. Is there, Jill, just as the
I don't know whether there's anything you wanted to add as a supervisor. I don't want to put you on the spot, but just if there's anything else that you wanted to add at this stage to the presentation from Lizzie.
I don't think so. Lizzie's given a really nice little nice overview there, and I really just want to say how much work Lizzie's put into this internship. You know, I wish her the very best in the future. It's been an absolute pleasure working with her. I don't think I've got anything to add to what she's sort of said for what we've been doing. Yeah.
Okay, thank you. I think again that sort of there's also another benefit in terms of the supervisor intern relationship as well. That will quite likely for many of us carry on beyond this internship experience and develop our networks more widely than we might have had previously. So
yes, I think we want our interns to stay in touch with us.
Yeah.
You know, it doesn't just end with a handshake and a goodbye.
Indeed.
You might regret saying that, Jill.
If there's anything specific about Lizzie's, if people want to put that into the chat, if not, we might just carry on with our next presentation so we can make sure we hear from all of our interns. So if you have any questions, please do put them in the chat, but if we'll carry on and move on to the next presentation, which is Connor, I believe. Yes, Connor.
Hi.
Can I hand it over to you, Connor?
Yeah, of course. Yeah, so my name's Connor. I'm currently doing the ARC internship within the digital health team. I'm probably going to echo quite a lot what Lizzie said, but I'll give my little swing on what I've been doing. So yeah, if we go on to the first slide, please. So I've worked at Wythenshawe for coming up to 5 years now. I did about 2.5 years as a rotational band 5. So I actually worked in transplants, but I think it would have been just before Lizzie got there. And then more recently, so over the past 2 years, I've got a post static in the musculoskeletal outpatient department. So the actual research experience I had prior to starting this internship, I got when I was on the Northwest Vent unit, having done a bit of research a long time, some of the respiratory doctors on there, which was a great experience. It was quite a small scale study. But we managed to get it published in the thorax, which was good. So that gave me a bit of an idea into the research world and a bit of experience there. But I was very much a sort of second in command, assisting more than doing, I'd say. And more recently in hand therapy, there's tons of research going on in there because it's a regional unit. So I've been involved in the collection of data, but again, never really taken on board anything myself. So when I started this, I was put in touch with a group of researchers at, well, they're from all around the sort of MFT Trust, but they're creating an app at the moment which is looking at sort of bridging the gap between patients and clinicians in terms of knee pain and also Parkinson's at the moment. So it's more of an interactive app with lots of different features, really complicated, and they're currently doing the funding for that process. So that was a really good experience for me to sort of get involved in that. And I think on the next slide, I go a bit more about that. So if we move on. So yeah, this is the group I've been working with, the Apatella Research Group. And we thought the sort of most beneficial sort of aspect that I could assist with would be if I completed a systematic review, which would hopefully then get incorporated into the grant that they're putting through at the moment. So I have started a systematic review, which is titled "The Effectiveness of Digital Physiotherapeutic Interventions in Improving Adherence Levels in Adults with Neurological Conditions." So, as Lizzie was saying before, to sort of start this process off, I had to do a Prospero protocol. So that got submitted and accepted, and then I'm currently in the process of collecting the data, and I'll hopefully start writing up in the next few weeks. And I'm working alongside Sabine, who I think is somewhere in this chat as well, but she's been guiding me as to sort of what little stages I need to be doing, and also put me in touch with so many different people throughout the research world, which has been great. And then in addition to that, I also did a master's module, but also mine was in quantitative research. It would have been great to do some research that is sort of my own quantitative research, but I actually think in hindsight doing the systematic review has given me a bit of a broader range of knowledge, because I'm looking at quantitative research, qualitative research, all the different aspects of research. So we've gone to the next slide, please. So yeah, the successes that I feel like I've gained from the internship is, one, in terms of networking. Like I say, I've worked with physios, I've worked with people that are solely researchers but not from the physio world, and I've been, yeah, the amount of resources and assistance I've gained from them has been phenomenal, which is good. I feel like I have improved my knowledge in all aspects of research, but in particular doing the master's module in quantitative research. That's where I'll hopefully take that forward and start to use it in the MSK outpatient department. And like Lizzie was saying as well, there's a lot of skills that I've gained that have assisted me in areas that I didn't think that they would assist me in. So, for example, I used to read a lot of research, but there'd be key parts that I didn't have too much knowledge on. Now I feel like I've got that knowledge, and I'm able to communicate it with some of my colleagues that are doing master's modules. So yeah, it's been great. And then last slide. So going on sort of with future plans following this internship, I've still got, I think, 3 or 4 months left of the internship, so I don't want to get too carried away. But the aim is to hopefully publish this systematic review in a journal, and continue after that's been submitted to actually work with the Apatella group, and hopefully they'll get the funding and there'll be lots more research options available in the future. I'd quite like to do some research of my own that's sort of a title that I'm really sort of specific to me and sort of the needs at Wythenshawe Hospital. So that'd be great to do. And then, yeah, looking for further opportunities to involve myself in research. So, for example, going through that pathway that Michelle was talking about before. But yeah, it's been great. I'd highly recommend it. And yeah, that's a little brief overview of what I've been doing over the past 5 months.
Thank you, Connor. Thanks very much. I think we're starting to see sort of the breadth of experience that people are coming to the internships with, and some people are, you could be anywhere on your sort of academic clinical research pathway. So you could be at the very start of that. You could have a very specific project that you really want to do. We've had a variety of people come with all sorts of different experiences. So I think the internship can really be tailored, and you can make it your own and develop from where you are and from where you come into the internship. That's been great. Thank you, Connor. Are there any specific questions for Connor around his work or anything that he mentioned in terms of his specific internship? Again, please do put those into the chat.
Maybe can I add something? It's Sabine.
Yeah, please do.
So I had the pleasure of supervising Connor, and I just want to say, Connor, you exceeded all my expectations by miles. You've done such a fantastic job. You've been very effective, but not only that, you sort of provided a key piece of the puzzle for the Apatella team who are preparing this program grant, and it's really important for an NIHR grant that you do a systematic review, and you've done that. So you've been a great addition to the team, very effective, and I really, really hope you consider applying for a pre-doctoral fellowship at some point, because I think you'll be great at it.
Thank you very much. It's been easy with the support that I've had, so yeah, can't thank everyone else enough.
Lovely. That's fantastic. Thanks very much, Sabine, and thank you, Connor. Shall we move on to any other questions or comments? Please do feel free to put them into the chat, but move on to Anna. Anna, can I hand it over to you? Is Anna with us?
Hello.
Oh, hi.
Yeah, I'm here.
Hi.
I'm here. Hello, I'm Anna McRae-Jones. I'm a senior sister I was a senior sister, more about that later, in the emergency department at MRI. And I undertook an internship, and that was within the mental health theme. So a little bit about my internship. So next slide, please. So about me, I'm very busy. I'm a senior sister in the emergency department at MRI. As you can imagine, it's a very busy environment. We kind of go from one crisis to the next. And Kirsten's heard all about it over the last 12 months, so yeah, she knows a lot about it. I was quite qualified when I started the internship. I'd done a master's in emergency nursing. As part of that master's, I'd done a Delphi study. One of my interests is triage, emergency department triage, and specifically within mental health. So I'd undertaken a Delphi study in which we looked at whether mental health triage was efficient and whether it could be improved, and kind of brought up alongside physical health triage. So I had a few seeds of a research project. I kind of had all the kind of ingredients as to where I could start from, but I didn't really know where to go from there, and it kind of just stopped, and I was a bit kind of lost about how to take those ideas forward and where to go with. And if I'm honest, I became quite disillusioned with nursing, especially in the emergency department. I found there was kind of a lack of evidence-based practice, and I felt that nursing was kind of more authority-based, and yeah, I just kind of was getting very fed up with where I was. Next slide, please. So I kind of came to this crossroads. I wanted to do research. I'd kind of dipped my toes in. I had all these seeds of ideas, but I couldn't find my way through. And I kept finding that each time I tried to take things forward, I didn't really know where to go. I didn't really have the right support around me. And I just found myself in this crazy busy department, and I just couldn't find my way through and get where I needed to be. So I came to this crossroads, and I thought, what am I going to do? So I can continue as I've always done, which is just going to work every day, sitting back, seeing bad things happen around me, wanting to make improvements, but not really knowing how to do it. I could resign and find a new career, which was definitely an option for me at that time. I wanted to come out of nursing. As I say, I just got so disillusioned by it. I couldn't find my way through. And I felt like, am I the only nurse who feels like this? Am I just somebody on my own here? Or I could develop and do something about it. So next slide, please. So decision time. So I decided to do something about it. I saw the ARC internship advertised. I wasn't really sure what it was all about, but I thought, you know what? I'm going to take a leap of faith. I'm going to go for it. I'm going to see whether this is my route through. Can they help me? Can they help me get to where I need to be? Mental health, as I say, was always an interest of mine. The mental health in emergency departments, the care, I'd be honest and say it's pretty poor. So I decided to take a leap of faith and say, like, I'm going to be the mental health lead here. I'm going to sit here and I'm going to try and make things better. And hopefully I can link up some ideas with ARC and try and bring them into practice into the emergency department. And I also took on the Transforming Triage project, which was triage at the front door of MRI A&E. Next slide, please. So the internship, what did we do? So we developed. So I've developed my research proposal, which is an evaluation of a new mental health triage, which is the seeds that I had from my initial masters. So we've kind of developed a research proposal and the evaluation of that new mental health triage, which will hopefully go live next year. If that's successful, that will be rolled out across Manchester Triage, which is used worldwide. So the impact of that is going to be absolutely massive. That should affect every patient all across the world if it's successful. I also developed a mental health training day at MFT, which I collaborated with Greater Manchester Mental Health Trust, which was looking at just training nurses, just looking at the needs of nurses. A lot of the nurses in A&E aren't mental health trained at all. Mental health was a bit of an unknown. It was a scary aspect to their job. So actually we sat down with Greater Manchester Mental Health. We looked at the needs. We looked at, parity of esteem, all those sorts of things, and how we can make things better. And we developed this training day, which now we're using not just for ED staff, but staff right across MFT, whether it's AMU, SAU, Major Trauma Ward. And we're just trying to link all the teams up. I've networked. So I've networked across the mental health research community. One of the best things that I did actually was took on the career advice, and I sat down and spoke to one of the research champions at MFT, which was Karen Kemp, and she really, really helped me actually. And it's crazy that I sat in MFT this whole time and I had all these kind of disgruntled ideas of, nursing isn't evidence-based, there's no research pathway in nursing. And actually I sat down with Karen and it was just like she turned the light on. She was like, there is a way forward, this is needed, you will be supported. It's just, I think I was just unfortunate that I hadn't made those right connections. And actually doing the internship, it just opened all these doors, and it was like all these right people I started speaking to, and they just helped me find that way through. So it was brilliant. It was really, really good. And that's really helped me. collaborated. So say there's the Parity of STEAM user groups. So I sat down with user groups, service users. That was brilliant just to see how those groups sort of worked out and how they were utilised, but also to sit and speak to service users. Actually, it was really useful for me. They talked about their experiences in the ED, the things that we could make better, just little ideas of, you know, how they felt, which then I went straight back to my workplace and said, actually, I sat down with some service users. These are really small, simple things that we can do straight away to make people's experience better, make the care better. We looked at priority setting groups, so we could sit down and see what, you know, the priorities are in mental health, where we need to go to, what needs looking at, how we can influence the care in the future. And the Manchester Self-Harm group was a brilliant collaboration that I got into as well. They're looking at patients who left before being seen by mental health services, all the adverse outcomes. We have a huge problem in A&E about people who leave before they're being seen. So again, we can use all that sort of evidence, all that sort of data, bring it down into practice and say, how can we use this? How can we make our service better? How can we make our patients' care safer? So all those things were really, really fantastic. So I did the qualitative research methodology, so I've learned all the theory behind that. And I say, again, just involvement with survey user groups and journal clubs were really, really helpful to me, and just learn loads and loads of skills which not only are just for mental health, but just used across my daily day-to-day job. And I brought those skills into the Transforming Triage project as well. And we've transformed the way that we triage patients at the front door. We've done loads and loads and loads of really great things. Next slide, please. So my impact's been quite great. So actually, rather than being disgruntled and being the nurse that kind of was defiant and just a bit kind of all over the place, I've actually got myself a new role. So now I'm clinical academic matron of the emergency department, which is great because it's just from feeling as though I didn't have a place, I couldn't find my way through, it wasn't wanted. Actually, it is very much wanted. There is a place for me, and it's really made a huge impact. And yeah, now I have this brilliant new job role, which involves research, teaching, quality improvement projects, and it's just fabulous. It's great. And I don't want to resign anymore, and I'm very happy being a nurse. I can say that it really has turned my career around. We're improving mental health care in ED, which is one of the biggest things and one of the biggest areas that I wanted to make an improvement with. Capacity building with colleagues. So now I've taken on this new role. Actually, people around me are saying, I want to be part of research. I want to do what you do. I want to make an impact. I want to do this. So, you know, I don't feel like I'm on my own anymore. And then we're just going to continue and obviously network within mental health and research with MASH and all the other databases and all the people that I've spoken to and made those connections with, just to continue to network with them and really bring that informed research down into care. And I feel really privileged that I can sit in this kind of translational kind of job where I can dip my toes into this side, say, okay, this is what it means to us and this is how we're going to bring it into practice down in the emergency department. Next slide, please. So future plans. So as I say, we're kind of developing this rollout of this new mental health system and how we can evaluate it. Before we get there, we're just designing a vignette study to inform the kind of full evaluation. So continue publishing best bets. So best bets are kind of short systematic reviews on clinical questions. So from my department, actually, the medical side, so doctors do these things very, very well. And actually what I want to do is make sure that nursing is also doing these things, and allied health professionals can use these systems and use best bets to answer these clinical questions and improve practice. And obviously use networks to further develop my research ideas. But one of the most important things is just to sit in that translation kind of area and support research into nursing practice to improve our care.
That's great.
And
Thank you, Anne. You've achieved so much. It's really has transformed kind of your career trajectory from your overview. So and I mean I was your supervisor. I am your supervisor. So I just think again I'd echo the other supervisors. I think you've done a fantastic job and really maximize the opportunities. And it's brilliant to see that it's led to a new role for you and sort of the realization of the project that you'd started and didn't quite know where to go with it, or you know couldn't find that route through. So it's been brilliant to have you as an intern, and I'm so pleased with where things have developed to and will continue to develop in your new role. So that's
I feel my internship was quite dramatic. I literally went from somebody who didn't want to be in nursing anymore, to the point of I don't want to be here. I'm not happy to a new job, and just feeling reinvigorated. And yeah, just it's been absolutely fantastic for me. It's changed my career.
That's brilliant. Oh, and hopefully it'll continue to make that impact within the wider system, like we've heard from Lizzie and Connor as well. So I think I think it's important for people applying as well to think, it doesn't necessarily need to lead on to a PhD or anything like that. So you were saying you were at a crossroads, not quite sure what to do, and that's, I think, exactly the benefit of the internship. And so you can come and be not quite sure whether you want to go into full-on academia or anything like that, and it's an opportunity to explore and find different routes that suit you and fulfill what you want to do. So I'd encourage anybody to apply, even if they're not, irrespective of whether they're certain or not. So there's no commitment to have to go on to do a PhD. But there is certainly an opportunity to explore that and take advantage of that route if people wanted to. So, and I think that's been brilliant. Thank you so much. Is there anything from anyone else who'd like to say anything at this point? There's some chat going on, additional information, which is really great, about what people have done and more information around that. So that will all be available as part of the recording as well when we make that available. Fantastic. Shall we've got the next two are even more virtual than normal. So I think, Michelle, you're going to present Chris Briggs' internship on his behalf, as he wasn't able to make it today. So if I could pass over to you.
Yes, so I'm going to Chris Bailey.
Bailey.
So I've
sorry.
That's okay, Kirsten. So I'm going to try and do Chris's presentation justice. Unfortunately, he has a clinical commitment today, so can't be with us, but has provided some slides. The reason I'm speaking on his behalf is I'm Chris's pre-doctoral supervisor. So if we could have the next slide, Hema. So the and I'm just so Chris had various ward-based and specialist nursing roles since 2017, but in 2017 he completed his Masters in Advanced Practice, and I met Chris as a MFT pre-doctoral fellow in 2018-2019, where he worked up a PhD application and submitted that to the British Heart Foundation Fellowship, Research Training Fellowships. It was unsuccessful. Having said that, he got a lot of very good feedback about where he could improve. And next slide, please. And what the ARC internship has done has helped him regroup. So this is Chris has taken the decision to think about, he'd done a pre-doctoral fellowship, but thought actually there were certain areas that he needed to strengthen in his application for doctoral funding. And what the ARC internship has given him is a great experience to be able to do that. He's been able to undertake some formal research training. He's developed his research networks, developed a Prospero protocol. So that's a systematic review protocol. But more specifically, and the thing that he was keen to clearly point out was the key area that the PPE group had played in terms of strengthening his research. And he writes here in his notes that the ARC GM internship has facilitated collaboration with patient and public involvement group to strengthen his study. And it's ensured that the patient voice is really obvious and present throughout his study design now. They've assisted him with plain English summaries, patient-facing materials, and he's found that it's been extremely useful. And a fabulous part of the internship is the access to that group. It's been able to increase his profile in terms of the work that he's doing in the hospital, and he's been successful in developing a protocol for evidence synthesis, which will one of the areas of the feedback for his PhD was that he wasn't making it clear about the evidence base for the intervention that he's hoping to develop. And so he's been able to develop that systematic review. And if somebody else, in terms of his PhD project, when I talk about the evidence base for what he wants to develop, he's developing a novel combined model of clinical follow-up for secondary prevention or for patients who are diagnosed with non-ST elevation acute coronary syndrome. And the evidence synthesis is going to support the clinical outcomes for that PhD. And finally, the next slide, which he talks about successes and impacts. So on the top of his list is the patient and public involvement impact. He's found that incredibly useful in developing and strengthening his PhD applications. His master's modules, the critical appraisal and evidence synthesis skills, he's learned a huge amount, and that's going to form a fundamental plank in his next PhD application, and I'm sure that that's going to be an area that will increase his chances of success. He's also had a clinical promotion. He's now lead nurse for cardiovascular services at MRI, and he's very close to a journal article submission, because that was one of the areas that he was considered weak in terms of his PhD application, was that his publication rate and his research skills. And he's been successful in gaining further funding for a bridging fellowship from HE NIHR to further develop his PhD application. It's been an absolute delight to supervise through this time. It's a long journey, but he's been building his skills and his experience, and I think it's a testament that to his resilience that he's kept going, especially through this difficult year. And also it shows just how competitive PhD funding is, and that it's definitely a team endeavour, and you need a team around you for success. So that's I hope I've done Chris justice in terms of presenting his slides, but I'm sure that if you put questions in the chat, I can let Chris have those, and or I can try and answer on his behalf. Thanks.
Thank you, Michelle. That's great. I was just thinking as you were talking, just reflecting, Anna, on a conversation that we'd had, and you didn't know Chris, but you're sort of at the MRI together, and so it's almost people with it doing internships, linking up, and it's system networking at almost every level that you can think of.
I met Chris probably, I think, about 2 weeks ago, and we never crossed paths. I say MFT is huge, absolutely huge, and you sometimes can sit in your little isolated world and you don't cross paths with these people. And actually I crossed paths with Chris probably about 2 weeks ago, and he's like, oh, you're Anna McRae-Jones. I was like, yeah, and you're Chris. And we had a really good chat, and it was just great. Like, he told me what he was doing, I was telling him what I was doing, and it's just great that you have somebody just to have a chat to. And he said, you know, I've had some difficulties doing this, and it's just, yeah, it's just that kind of support network that you can build with each other is fantastic. And otherwise we would never have crossed paths, really. We would have stayed in our little individual bubbles. But yeah, it's great to just network with each other and chat and have some support.
Yeah, that's brilliant.
And Kirsten, I'm aware that the other thing to say was that I am Chris's pre-doctoral supervisor, but I wasn't his ARC internship supervisor, and I think Seimo's on.
Yes.
Yes.
Oh, I think she is.
I am, yes. Hello.
Yes.
I don't know if you wanted to add anything.
But yeah, I just wanted to echo what Michelle said. Chris has been a great intern, and he's had some knockbacks and things with his previous applications, but we really tried to fill the gap, so to speak, so then future applications, and it was myself and Chris Todd from the Healthy Aging team at NIHR GM. So yeah, it's just been I'm really proud of some of the things that he's achieved, and he's never let his sort of let it sit and pick himself up again and, you know, try again, and really consistent and committed to it. So, yeah.
And it's been a really great collaboration in terms of recognizing what the feedback and what you've been able to, and I think it's a good example of what an internship allows you to do, is to look at the gaps that you need to fill and then develop a plan to specifically fill those gaps, and that's been really useful.
Yep, definitely agree.
And I think just from all the supervisors, certainly from my perspective, but I think from others as well, I think we've really enjoyed supervising as well. So it's been a positive experience. It sounds like from the interns, which is great. But certainly I think as a supervisor as well. I don't know whether any of the other supervisors on the line would want to comment on that or not, but certainly from my perspective, that's been the case. Should we move on to, I think we have one more, and Liz Murphy was not able to be here today, but she has narrated, that's the word I'm looking for, narrated her slides. So they should just play as we go through them, so fingers crossed, you never know what's going to happen. But I'll let it play and hopefully we can hear it. I'm not hearing anything at the moment though. I'm not sure if anything needs to be enabled. I did try this out earlier.
Kirsten, with Teams, you usually have to click a button before you share your screen that says something like enable sound or something like that.
Okay. Hannah, I'm not sure if you can see that.
Bear with me, sorry.
If anybody else can point us in the right direction. I'm much more used to Zoom, I have to say, so apologies. Is anybody familiar with where that button might be?
You might want to try just present it in the standalone presentation, Kirsten, that she sent you. I have a copy of that if need be.
Okay. Hema, if you want to stop sharing just at the moment, and then I'll go back and just share my screen.
Okay. It definitely played when she sent it to me.
It did. It did. So I've got her original presentation up. Hema, if you could stop. Yep. And then I will try and share mine and see if that works. Can everybody see that?
Yeah.
Yeah, okay, so I'll give it a whirl. There we go. Sorry, folks, I don't know what I've just hit. I will try it again. Oh, the joys of IT. Right, here we go.
If we're still having problems, I can talk a little bit if necessary.
That sounds like a good idea. Thanks, Jill.
Yeah. Can nobody see or hear that?
I can see
it but not hear it.
See it but not hear.
Okay, so I can hear it. So there's clearly something enabled on mine that isn't enabled on someone else's. Jill, do you want to just talk through it if you wouldn't mind briefly?
Yes. It's a shame because Liz has obviously got a much better sense of her previous experience. So Liz is currently working as a midwife, but she's also a very experienced nurse before that. And she's worked all over the world and has previously done a master's before taking up her current role, I think. So Liz didn't have a sort of project in mind when she came to join us. So we talked a bit and decided that one of the things that might be useful for her to do was to do some work on updating a review, part of which was very relevant to her work as a midwife, because the review included a lot of trials of women who'd had cesarean sections. So she brings all this wealth of experience in nursing and midwifery, and she has a master's degree, but not one with a very strong research methods component. So while she's been with us, she's been accessing the module in critical appraisal and evidence synthesis, and she's still continuing to do that because she joined us in January, so she's just over halfway through her time. So she's been working with me on updating a Cochrane review of negative pressure wound therapy for closed surgical incisions. And she's done so much work on it that she's going to be an author on the updated review. She's used the time to go to a virtual conference, again, on systematic review methods. And she, like Lizzie, who you heard from earlier, has completed extra training on systematic review methods, as well as the research module. And she's taking time to sort of explore what she might want to do further, because she does think that she might want to do a PhD in the future. And she's going to use the final bit of her internship to focus in on that subgroup of patients from the systematic review, and explore the outcomes for them in depth for a presentation to take back to her team. And you know, it's been an absolute, pleasure to work with her, and I'm really sorry that we haven't been able to play her words, because they'd be so much better than mine. And I am happy to answer any questions on her behalf. And she's also said that if she's happy for people to ask questions and have them sent on to her by email.
Thank you, Jill. I couldn't play that on mine because I could hear her talking. So on my computer, I could hear her talking. So apologies. That was a great summary. And we will be making the slides available on the GMR website. So you will, if everybody logs onto there in due course, you'll be able to hear her speaker words. But thank you, Jill, for doing that on the spot. And that's a great summary. And I think she's really enjoyed the internship as well, and the opportunities that it's given her. And like she put in her slides, it was a great try before you buy kind of opportunity. So to know where exactly you want to go. Does anybody have any comments, questions? I'm just trying to look through the chat at this stage about anybody's experiences or any questions about the internship or what, anything around that. Do feel free to add them into the chat, and we'll try and capture that. At this stage, maybe if we move on to you, Rebecca, and maybe just go through the practicalities of it and see how folks might go about applying if they are interested.
Yes, of course. Can everybody see my screen okay? It should be the NIHR website. Okay, so in terms of how do I apply, everything's online, as you would expect in today's day and age. And we've put a lot of information on our ARC website that will hopefully help applicants navigate their way through this process. So you can see that there is a training section here, and there is a specific section for internships. So this section talks a little bit of an overview of what the internship is. As Michelle was saying, it's 30 days or 225 hours over 12 months. And we're very flexible about how that time is used. We have capacity for up to 10 interns starting in September 2021. There isn't backfill, but as we've seen, there's a lot of a chance to enhance your skills and knowledge in research. and a training budget, and also the opportunity to undertake one fully funded master's module in research. That doesn't have to be at the University of Manchester, it can be from any university across the Greater Manchester patch. So I guess when you're looking at this, the bit about here where we're talking about the internship webinar is what we're doing today. So here is probably where you'll see the video popping up of today, and we'll put that on hopefully by the end of this week. You've also got profiles to the current interns, of which you've heard from a few of them today. I guess the sections that probably draw your attention to the most is, am I eligible to apply and how do I apply? And also, what are the research themes in the ARC? I'd say those were the real key sections. So make sure that you're eligible. There's 3 criteria that need to be met, which I'll come on to in the form shortly. The key dates, obviously, we've just launched at the end of June. The deadline is the 29th of July, so there's a full calendar month there to apply. Shortlisting in August, interviews early September, and starting sometime in September. So the how do I apply, sorry, is the section I'm going to be talking about, and everything's on Google Forms in terms of the application form. Some questions have got word count restrictions, so it's sometimes a good idea to write your questions in say a Word document and just check you haven't gone over the word count and then paste everything over, particularly because with an online form you might want to save your answers and look at them later, and it's not easy to do that if you've submitted an online form and then can't access the information again. Also, in addition to the online form, there's also a requirement for written letters of support from your line manager and your service manager. They need to be emailed to the ARC GM inbox before the deadline of the 29th of July, and you can download a template for the letter of the support here off the website as well. So I'll just talk you through briefly the form, and just to say, in terms of the technology and the practicalities of accessing this form, Internet Explorer doesn't really work that well with Google Forms. I do believe that it is being phased out at the moment. So if you can, try and use one of the popular browsers such as Google Chrome, Firefox. If you've got a Windows PC, you might be using Microsoft Edge, or if you're using a Mac, then it's more likely to be Safari. But all of those should work. But I believe that Internet Explorer is quite tricky. So I'll go into the form then. Actually, no, I won't. Just before I do, I'm just going to go through the research themes in the ARC. Now, the reason I'm going through this is because every internship is linked to at least one of the research themes of the ARC. And it's important that you do a little bit of research before you apply about where your interest aligns with these research themes. And within each theme, you'll see that there's some suggestions of potential internship topics that fall under that theme. So, for example, in digital health, at the moment, it's really a hot topic around digital inequalities across different patient populations. And obviously, this has been exacerbated by the pandemic. So if your research aligned with that, you might want to apply for something under the digital health theme. So, and we have got contacts of people that you can discuss here. Sabine was on the call today. She's been one of our intern supervisors, so they can help you decide if that's the right theme for your research interests, if you see what I mean. So we've got 7 research themes. They're all there. They've all got different contacts information, and I'll mention that when I come to the form again. So it's just to let you know where that information is. So moving on to the actual application form then. This is what it looks like. I'm in Google Chrome at the moment accessing this, and I'm going to put some dummy data in just so you can see how it all works. This first screen here is all about eligibility screening. So unless you are eligible, it won't allow you to go into the next parts of the form. So I'm going to say that I'm registered with Social Work England as a health and social care professional, and that I'm employed by a social care organisation, and that I know that my line manager and my service manager is willing to support me in this internship and give me those 30 study days that I need to do this. And in the background, I'll be checking with them that they can do a support letter and send that in for me. So if all those criteria are met, it will let you move on to the next section where you'll enter your details. So I'm just going to briefly enter some details here, and I think today I'm going to call myself Richard Smith. And there's some validation on some of these. So if you enter, for example, an incorrect email address, it won't allow you to proceed, just as any other standard forms, I guess.
I think it's safe to say that the form is fairly succinct, so don't think the form is, if anybody wants to apply, it isn't onerous. It's pretty straightforward, so it's very user friendly. So Rebecca's done a lot of work on that, and Emma.
So here, we ask you for the name and job title of your line manager and your service department manager, just so that we can tie up the support letters with what you're emailing us to your application form, so we know whose is whose approval, if you see what I mean, just in case they get lost. Here's a summary of your current roles. Like I said before, there are some word counts, so I'm just going to type in everything for every answer, but you get the general gist. The next section then is all about qualifications and professional registration. So here you might put in, you know, if you've done a degree or a diploma, and your registration number. And then it will allow you to move on to the next section. So it's mainly about your higher education qualifications and your professional qualifications to include there. And then this bit is all about research experience and training. Now, we do recognise that not everybody's going to have a lot of research experience and training. So this is really just as a guide for us to understand where you are in that research journey, and then we can tailor any potential training to your individual needs. So you can skip this and say not applicable if you haven't got any specific research experience or training in this area. And again, the same with posters, publications and conference presentations. Not everybody will have those. Moving on, this bit is about why do you really want to undertake the internship? What are you hoping for, and how will that impact on your future career plans? You might not know, but I guess it's interesting to understand what your aspirations are at the starting point. And then finally, the question that I was alluding to earlier was, which of the ARC research themes are you interested in undertaking your research internship in, and why? So this is where you'll link back to at least one of the ARC themes and mention how your interests align with our interests. And like I said, you can talk to one of us in the contacts there and work out how that might work in practice in terms of the suggested internship topics that we've offered. And then finally, it will just go to equality, diversity and monitoring questions. As Michelle mentioned at the very beginning, we are trying to improve our reach in terms of diversity. And this is our way of monitoring how many people from diverse backgrounds we attract and how many we appoint and how many go on to progress in their career. And obviously we can set targets to improve that if we know where the gaps are, I guess. So all this information is entirely separate, kept, even though it's all in the same form, it's kept entirely separate to your application. So it's not used in any way to make decisions about your application. And it's held in the strictest data protection, you know, unless certain people can access that information. So you do need to give consent that you're willing for us to share, to use that information for monitoring. And of course, if you want to say prefer not to say to any question, you can always choose that as well if you don't want to tell us. So it's better to just choose prefer not to say than to try and skip through it, because I'm not sure it'll allow you to skip through everything. But you can just tick prefer not to say. And I think that's it for the application form. I'm just going to try and move along and see what happens at the end. I think I've ticked everything. Okay. Page 6 of 7. I'm going to say that I prefer not to say for some of them and choose the answers for some of them as well. And then you'll be asked if that information is all correct, and you can tick agree, and then you should get a confirmation telling you that we've received your application, and that will come through to us live the same time that you submit it. So it's really fast, and we will tie that application up to your support letters as well. So that was a bit of a whistle-stop tour on how to apply. So I don't know whether there's been any questions in the interim about any of that, Kirsten.
Not that I can see. I'm just looking for hands or anything. No. But that's incredibly useful, because as we're not only doing it today, we're going to be sharing that on the website as well. So anybody who isn't able to attend today will be able to walk through that. So that's been incredibly helpful. Does anybody have anything to add at this stage? Opening it out to absolutely everyone. Any comments, queries?
I just wanted to ask one question, Rebecca. If you press submit and then you suddenly realise that you've forgotten to add something, is that it? Do you have to be really, or can you go back in and edit?
I did toy with the idea of making it editable, but it turned out to be quite complex because you have to sign into Google, you have to have a Google email, all those things which make it more complex for applicants. So in the end, what I'm suggesting is that you can edit, but if you type all your answers out first into a Word document and then cut and paste across, at least you're confident with what your answers are, yeah, and you're happy to submit.
No, that's good advice, Rebecca. So it's just to read, you know, don't hover over the submit button until you're absolutely ready to go, because there's so yeah, that's just a useful bit of advice.
Good point, though. Thank you, Michelle.
That's great. We're about 20 past. I've been looking at the chat, and I'm trying to extract the chat, which we can make available as well when we put everything up on the website. So just comments and queries that folks have had, just sort of as an FAQ, and just people's comments about how useful it has been from both supervisors as well as interns. So I think it has been a very positive experience all around. And Claire, I liked your comment about Anna's presentation about the honesty. So sometimes we don't feel able to share where we are really in terms of our careers, and that we're perhaps not as joyful as you know, we might feel we need to pretend to be. So I think it is a really useful exercise to say, this is a really good opportunity to say, you know, I really don't know which direction I want to go in, but I want to change, and it's a taster, and it could lead to all sorts of wonderful things. Not least.
I also agree, Kirsten, as a clinical prof in MFT, Anna, I really appreciate your honesty about just to give you context, there are 10,000 nurses, midwives and allied health professionals in MFT, and probably about 60 to 70 of those are doing clinical academic work. So your chances of bumping into somebody are low. But what the internship does, which you've so beautifully described, is it increases your chances of bumping into those people and networking, because networking within our professions of 10,000 people in one hospital is you can quite easily not meet people like Chris who are working in the same hospital as you in your normal day job until you, I think the phrase you used is, I'm going to take a leap, I'm going to step out. And so that's a really encouraging thing to other people of just how much, and the other, just to summarize just how beautifully each person in terms of their internship experience has shown the impact on recruitment and retention. I am so pleased, Anna, that you still want to be a nurse and that you're staying in MFT. I'm absolutely thrilled. But I'm equally very proud and heartened to hear the impact that frontline clinical staff can make important contributions. So it's not just about what ARC staff give interns, but what actually that partnership, that's what the whole ARC GM collaboration is about, is that partnership in terms of Sabine mentioning what Connor had given back in terms of being a key part in that research program, and then Lizzie talking about the ripple effect of what the work that she was doing and how that had a ripple effect in terms of the people in her workplace. And so it just joins up those evaluations at the beginning that I spoke about, which were qualitative and survey evaluations. We're seeing that bearing fruit in the interns here. So it's been a fabulous, from my perspective, really great to hear, and I know that it takes time to pull those things together, but I've certainly appreciated hearing about it.
Absolutely. So I'm keeping one eye on the chat as we've been going. So I think we're probably at the stage of closing, unless there's any final comments or queries. Obviously, if there are any comments, feel free to share the information about the internship far and wide throughout your networks. There's it's posted on various websites, on the GM ARC website, and you can always get in touch with us directly, or any of the interns or supervisors. By all means, get in touch with any queries or comments. And as I say, we'll be making this available in due course. So again, you can point any of your colleagues who may be interested to it. And just to say again, it's open to anybody in GM, so health or social care. So certainly make it, please feel free to advertise that to all of your colleagues around the system. Is there anything else? Final comments from anyone? No? Okay. Right. Thank you, everybody. Thank you for everybody for presenting and contributing, and have a great rest of the day. We'll see you soon.